My name is Dr. Marcos Nores, and I'm the medical director for the Lynn Heart Vascular Institute at Baptist Health. Through the years, the role of the cardiac surgeon has evolved in ways that are like everything else has evolved to what's called less invasive surgery. People want to have smaller incisions, or maybe incisions do the same operation through a robotic. But more than anything, sometimes the least invasive of those are the ones that can be done with a catheter. Not only did it provide a lot of benefit for the patients by not having to have the chest open, but it also brought together physicians to look at the patients through many ways. So I want to say that's probably one of the most important changes. Say there's like two types of journey for patient interaction. One, it's in the hospital, which is different. They maybe come under some urgent situation, contradiction to maybe what we experience in the office. When you have more of a quiet environment, we have more time. The first thing that I do when I see a patient, I sit down. And in my mind, I say, no matter what it is, this is your time. And I tell them that because I think it's important that I can understand what their problem is, and then also gives me time for them to understand what is it that I'm proposing. I think when people understand what they're getting into and the expectations are a little more clear, I think it works better. Many times they come to me and they say, well, I don't want to take your time. It's like, no, this is your time. It's just whatever you want. In terms of empathy, I feel personally that I want to be as empathic as I can with any human being around me. I tell that to my children. I try to practice that every day, and especially with the patients. We have the privilege of treating human beings and people and individuals at their most vulnerable time in their life. When they're sick, they put themselves on someone else's, a stranger's hands. And I think for that reason, if you don't see that, if you're not empathic like you're asking, I think you're on the wrong profession. There's excellent care here in Palm Beach County and the region, and require this collaboration between all the specialties to take it to really become what it should be, the quarterly cardiac surgery program in the country. I think just by working together and collaborating with the ultimate goal of always keeping the patient at the center of the care, we will be able to achieve that.